I'm Bob Beckel. I'm proud to be a liberal. I believe that health care is a right, not a privilege.
Hi, I'm Cal Thomas, a conservative who is pro-life. And this is Common Ground. Welcome to Common Ground, a video version of Bob Beckel and my bi-weekly USA Today column in which we try to figure out how to bridge Washington's partisan divide. And Bob, there's probably no bigger divide right now in Washington than health care.
Boy, isn't that the truth? You know, they say that Social Security is the third rail of politics. I think it's health care. Look, they've been trying to reform health care since Franklin Roosevelt. And every president has tried it, and usually it's to get universal health care, by the way. You got 46 million of Americans who have no insurance. And the idea of getting universal health coverage just doesn't seem to have a path that people can follow and find some common ground on.
Well, you know, the problem is if you go to the doctor, what's important is that you get the right diagnosis before the treatment. And my view is that the right diagnosis is in the hospitals. It's not with the insurance companies, although they have their problems, and it's certainly not with government. There's so much waste that's going on in hospitals, tests that are done that don't need to be done. And one of the major reasons for that, of course, is the fear by doctors of malpractice insurance, something that President Obama, when he had an opportunity to address at the AMA in Chicago, said we're not going to do anything about, and he got booed for it, and rightly so, in my view, by the doctors.
Why do I think that it took you about a minute to get the trial lawyers, right? Because they're big Democratic supporters, right? Now, look, there are too many trivial lawsuits. I agree with that, but there are also, I don't want to leave people without that option in case there's some bad malpractice done, and there's a lot of that done. Let's go back to the hospitals for a second. It's not the hospital. There's a lot of waste in hospitals, as you pointed out. There's a lot of waste in doctors' offices, and it just seems to me that we're treating diseases more than trying to get people well. I mean, or keep them well.
Exactly. You know? That's a great point. I'd like to go back to the Kennedy administration. You can barely remember that.
I barely can.
He had something called the Presidential Council on Physical Fitness. Being fit, being in shape was cool. It was in. It was hip. You had the president doing the touch football thing. You had Viga for vigor. That's how they talk in Massachusetts, you know. And it was really great. Now you've got obesity is one of the major problems of our young people today. You got the sugary soda machines, you got the snacks in the schools, and you got more sex ed than phys ed. Maybe if we gave more phys ed, they'd be too tired to do what they're trying to prevent in sex ed.
Well, I'm not against the sex ed part of it, but you're right about the obesity issue. Look, obesity leads to any number of problems that are long term. And if you talk to doctors who follow this, then they'll tell you it's the single biggest health risk in America. But let's get back to this health care reform bill that's moving through, or trying to move through. It's very costly. I don't think it's going to get through without that it can be paid for. I think Obama understands that. The Congressional Budget Office came out with $1 trillion plus on these bills. So I would like to see a public insurance program to compete with the insurance companies. You guys on the right seem to think the insurance companies are wonderful people that just make a few mistakes. I think they're gouging the system for all the money they can make, and to have competition with a public entity is a good idea.
Well, the problem when government gets into something, as you well know, having been in politics for a long time, let's say that you're indicted, a federal indictment comes down, you have to hire your own private attorney, and the federal government has unending resources. The government, if it competes with the private insurers, will be able to undermine them. It will be able to outspend them. It will be able to reduce the costs. And what's going to happen then is that the private insurers are going to go out of business, and government will be the primary and eventually the exclusive insurer. And you know what that means. That means they'll be able to decide whether you get that heart surgery you had a few years ago with private insurance, and if they decide you're too old and not worth it anymore, especially under a Republican administration, you're history.
Well, thanks for reminding me about my heart operation. But look, I do think that the Democrats are not going to go forward with a bill unless they have some kind of public option. The Republicans are going to try to stop it if it does have a public option. So is there any way around this? There may be. Senator Conrad has proposed the idea of cooperatives, where people, like rural cooperatives with electrical cooperatives and farm cooperatives, where people come together jointly and buy and form themselves essentially an insurance company. I think it's an idea that's worth trying out. What do you think?
I do too. I think that's got some great potential. It puts a wall between government and the person who is supposed to be helped. And I think that's a good thing and has some possibilities. And I think that's a potential common ground issue. It's something we need to look into.
How about taxing health care benefits?
You know, I think that's going to only add to the cost of businesses, which will be taken out of the employees. You know, you get these packages now as part of your compensation. But if you're taxing the health insurance as a direct benefit, then they're going to pay the employees less or raise the prices. It's got to come from somewhere.
You know, I had to end with taxes with you because I knew it would get you riled up. Look, hey, we're out of time here, so check out our column in the paper and on USA Today's opinion blog at usatoday.com. Thanks for tuning in, and come back again in 2 weeks for the next installment of Common Ground.